Good morning to everyone who makes possible this broadcast, to Pepe Mejia, who joins us today, to the sign language interpreter, and the audience tuned in to this briefing. I would like to start today's press conference by congratulating all the elderly population in our country. Today we celebrate the International Day for Older Persons. It was designated by the United Nations General Assembly on December 14, 1990, as an international plan of action on aging and adopted by the 1982 World Assembly on Aging. I also send my congratulations and acknowledgements to the medical personnel working on the statistics field, since we celebrated yesterday the National Day for Health Statisticians, and I take this opportunity to highlight the important role of this profession in our country, mainly these days of COVID-19. That said, as of today, we report 6,669 hospitalized patients, 4,825 under medical supervision, 1,220 are suspected cases, and 624 are confirmed active cases. Yesterday, 7,186 samples were processed at the molecular biology laboratories of our country, 2,283 at the Tropical Medicine Institute Pedro Coury, 996 in Havana's Hygiene, Epidemiology and Microbiology Center, 933 in Villa Claras, and 287 in Santiago de Cubas. 540 samples were processed in the Naval Hospital, 431 in Hermanos Amejeiras Hospital, 361 in Manuel Fajardo Hospital, 356 in ICA's laboratories, 306 in Fructuoso Rodriguez Hospital, 299 in the National Civil Defense Labs, 196 in the National Center for Genetics, 109 in the Center for Molecular Immunology, and 89 in the Genetic Engineering and Biotechnology Lab. As a result of the analysis and processing of these 7,186 samples, 73 people tested positive for COVID-19. That brings the total number of samples processed since the pandemic began to 621,180, of which 5,670, or the 0.91% of people, have been diagnosed with the virus. Samples from all of the country's provinces were tested depending on its epidemiological complexity. Pinar del Rio processed 130, Artemisa 121, Havana 3,430, Mayabeque 293, Matanzas 671, Cienfuegos 206, Villa Clara 157, Santi Spiritus 274, Ciego de Ávila 1,244, Camagüey 273, Santiago de Cuba 149, the Isle of Youth Special Municipality processed 74 samples, and so forth from every Cuban territory. 72 of the 73 people diagnosed yesterday are Cubans, and one is a foreign resident in our country. She recently arrived to Cuba, was properly treated and isolated. It does not affect Cuba's incidence rate since it is an imported case. 72 of the 73 cases, or the 98.6%, are confirmed case contacts. The 91%, that is 5,161 of all diagnosed cases in Cuba, have had contact with someone who previously tested positive to the virus. The figure of patients whose source of infection is being investigated over the last 15 days stands at 66. There are no modifications in this regard, since yesterday all patients were linked to previous confirmed cases. As I mentioned, one patient contracted the disease abroad, and it accounts for 443 imported cases, that is the 7.8% of all diagnosed cases. 49 patients are male and 24 are female, for a 51.2% and a 48.8% respectively. 52 of the 73 patients, that is a 71.2%, were asymptomatic at the moment of the test. This figure therefore means that a 60.7% of all confirmed cases in Cuba up to date did not present any symptoms while being tested. That is a 70.2% over the last 15 days. 4 individuals are under the age of 20, of which 3 belong to pediatric ages, what stands at 615 diagnosed patients under the age of 18. The 85.8% or 528 are discharged and recovered from the virus. 29 patients are between 20 and 39 years of age, 33 between 40 and 59, and 7 belong to the 60 or more years of age group. Of the 73 diagnosed cases, 50 are from Ciego de Ávila, 13 from Santi Spíritus, 9 from Havana, and 1 from Matanzas. In Havana, the 9 cases belong 1 to Playa municipality, and this is the imported case we mentioned already. 2 cases belong to Habana Vieja, 1 each to the municipalities of Cerro, Centro Habana, Regla, Habana del Este, Boyeros, and San Miguel del Padrón. The diagnosed patient from Matanzas belongs to the municipality of Limonar. In Santi Spíritus, the 13 patients belong 12 to the municipality of the same name and 1 to Trinidad. The 50 cases from Ciego de Ávila belong to the municipality of Ciego de Ávila. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants over the last 15 days continues to be the highest in the country, with 62.92. Havana's rate decreases to 16.67, Santi Spíritus increases to 12.02. Meanwhile, the provinces of Matanzas with 10.14, Camagüey with 0.39, and Holguín with 0.2 remain with similar rates compared to the day before. Mayabeque and Artemisa have lowered their rates to 2.6 and 1.94 respectively. With this analysis, of the 5,670 diagnosed patients in Cuba up to date, 624 are hospitalized active cases, that is the 11%, of which 615 or the 98.4% are clinically stable. We did not report any deceased patients today, hence the figure of COVID-19 fatalities stands at 122. I always mention the 2 patients evacuated at the start of the pandemic. Yesterday, 29 patients were discharged from hospital, not a positive indicator concerning discharged diagnosed cases ratio. The 29 discharged patients belong 2 to Artemisa, 16 to Havana, 2 to Matanzas, 1 to Santi Spíritus, 4 to Ciego de Ávila, and 1 to Santiago de Cuba. Thus, Cuba accumulates 4,922 patients, that is, the 87% of all diagnosed cases in Cuba recovered from the virus. 2 patients are in a critical state, admitted 1 to Camagüey and 1 to Matanzas hospitals. 7 patients are in serious conditions hospitalized, 4 in Havana, 2 in Camagüey, and 1 in Villa Clara. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 291,144 people were diagnosed with the disease only yesterday, for a total amount of 33,714,661 diagnosed cases. 6,254 fatalities were reported yesterday, what brings the global death toll to 1,008,932 and the mortality rate to 2.99%. The region of the Americas stands at a 49.47% of all cases worldwide, with 112,678 new cases diagnosed yesterday, what accounts for 16,679,022 infections. 3,249 deaths were reported in the region yesterday, for a total amount of 557,066 fatalities and a mortality rate of 3.34%. The United States continues to top the list of the worst affected countries by the pandemic, with over 7,191,000 COVID-19 cases and 205,998 fatalities, followed by India with 6,225,763 cases and 97,497 fatalities. Brazil with 4,777,522 diagnosed cases and 142,921 deaths. And Russia with 1,167,805 cases and 20,545 fatalities and a mortality rate of 1.76%. In the Americas region, right after the United States and Brazil, comes Colombia with 82,402 COVID-19 cases and 25,828 fatalities. Then follows Peru, Mexico, Argentina, Chile, Canada, Ecuador, Bolivia, Dominican Republic, Panama, Guatemala, Honduras, and Cuba occupies the 21st position, with 5,670 diagnosed cases up to date and a mortality rate of 2.15%. This is all the information on the behavior of the pandemic in Cuba and the world.